Hello and welcome. In today's video, we are going to talk about Avoidant Personality Disorder, also known as AVPD. If you've ever heard of this disorder but don't really know what it means, or if you or someone you love is experiencing it, then you're in the right place. We'll dive deep into the symptoms, causes, treatment options, and how it affects someone's life. So, let's get started. What is Avoidant Personality Disorder? First, let's break it down. Avoidant personality disorder is a mental health condition that affects how someone thinks, feels, and behaves. It is marked by feelings of extreme shyness, fear of criticism, and a constant sense of inadequacy. People with AVPD often avoid social situations because they fear being judged or rejected. It can make everyday interactions feel overwhelming and exhausting. Symptoms of avoidant personality disorder. So, what are the main symptoms of AVPD? Well, people with this disorder tend to feel very self-conscious and have low self-esteem. They might believe they are socially unworthy, which leads them to avoid activities where they might be exposed to judgment or failure. This can include avoiding work projects, social gatherings, or even romantic relationships. Other common symptoms include being easily hurt by criticism, feeling inadequate in social situations, and fearing embarrassment. These feelings can create a constant cycle of isolation, which can make the condition worse over time. Causes and risk factors. Now, you might be wondering, what causes avoidant personality disorder? While we don't have a single answer, experts believe a combination of genetic and environmental factors plays a role. For example, childhood experiences, like being overly criticized or experiencing neglect, can contribute to the development of AVPD. Additionally, if someone has a family history of anxiety or other mental health disorders, they may be at a higher risk for developing AVPD. How AVPD affects relationships. One of the most challenging aspects of AVPD is how it affects relationships. People with this disorder may withdraw from friends, family, and romantic partners, not because they don't care, but because they fear being judged or rejected. They may feel misunderstood or believe that others see them as inferior. This can lead to a lot of loneliness and difficulty forming close, meaningful connections. Over time, this isolation can worsen the symptoms of AVPD, creating a difficult cycle to break. Coping strategies for AVPD. Although AVPD can be a tough condition to manage, there are coping strategies that can help. One of the most effective approaches is cognitive behavioral therapy, or CBT. This type of therapy helps individuals challenge and change negative thoughts and beliefs about themselves. Gradual exposure to social situations can also be useful in helping someone with AVPD build confidence. It's important to start small and work your way up, at a pace that feels comfortable. Other strategies include practicing mindfulness, self-compassion, and setting realistic goals for social interactions. Effective treatments for AVPD. Now, let's talk about treatment. Therapy is the cornerstone of managing AVPD. Cognitive behavioral therapy is especially effective, as it helps address the negative thoughts and beliefs that fuel social anxiety. For some, medication like antidepressants or anti-anxiety medications may also be prescribed, particularly if the person is dealing with other conditions like depression. A combination of therapy and medication often provides the best results. How to support someone with AVPD. Supporting someone with AVPD can be challenging, but it's so important. If you have a friend or loved one dealing with this disorder, the most helpful thing you can do is be patient and understanding. Avoid pushing them too hard or too fast into social situations. Instead, offer gentle encouragement and let them know they are not alone. Acknowledge their feelings without judgment, and remind them that it's okay to take small steps toward overcoming their fears. Real-life stories and testimonials. To give you a real sense of what it's like to live with AVPD, let's share a few personal stories. One individual shares that, "I've always felt like I was on the outside looking in. I avoid events because I'm terrified of being judged or feeling awkward. But therapy has helped me a lot in managing these thoughts, and I'm starting to take small steps in overcoming my fear of social rejection." Conclusion. In conclusion, avoidant personality disorder is a serious condition that affects many people around the world. It causes individuals to feel socially inadequate and fearful of judgment. But with the right treatment and support, it is possible to manage and even overcome these challenges. If you or someone you know is dealing with AVPD, don't be afraid to seek help. Remember, mental health matters, and there is always a path toward healing. Thanks for watching. If you found this video helpful, make sure to like, subscribe, and hit the bell icon to get notified when we post more content on mental health. Share this video with anyone who might benefit from understanding AVPD. Let's start the conversation about mental health and break the stigma together.